All right. So, hey, everybody. So, my name is Jackie Walter. I am a broker here at Translating Insurance. And I do want to thank you all for attending our webinar on the Inflation Reduction Act. We are going to be providing some really valuable information here today just to prepare you guys for what's coming with the changes in 2025. So, we have heard estimates that in normal enrollment years, about 25 to 30% of Medicare beneficiaries need a plan review. But for 2025, they're estimating that 80% of Medicare beneficiaries are going to need a plan review. So again, this webinar is not meant to scare you. It's not meant to alarm you. It's actually meant to empower you guys with knowledge so that you can make an informed choice about your coverage for 2025. So Melissa Sargent, Christina Morano, and I, Jackie Walter, will guide you through the changes and let you know how this is going to impact your coverage choices for 2025. There will also be time at the end of the presentation for a Q&A session, and you can also type your questions in the chat, just in case you are worried that you might forget what you want to ask later. Just type it in the chat, and we'll take a time at the end to go through the chat questions first. And then we'll open up the mics if anybody has any questions they want to ask out loud. The only thing I ask is if you guys would please not share any personal health information in the chat or, during the Q&A portion. Just if you have a question about a specific prescription that you're taking or a specific impact to you, just ask us directly through email or give us a call after, okay? And again, we're not able to go through specific 2025 plan information until October 1st, but this webinar is designed to at least give you an idea of the direction in which to expect the plans to go. So hopefully that makes sense. And next, we're going to go to Christina. Oh, Melissa. Sorry, Melissa's next.
Thank you, Jackie. Hi, everyone. I am Melissa Sargent, a licensed insurance agent at Translating Insurance, and I would like to take a few minutes to go over the Inflation Reduction Act and what it covers. So why is this important? Because of this act, the most significant changes will occur to Medicare in 2025. The effect is widespread and will affect most Medicare beneficiaries, especially if you're taking any prescription drugs. So today, we're going to go over why these changes happen, what they are, and how they may affect you. And we'll talk about next steps so that you're ready, informed, and that you can have a plan in place. Okay. All right. So what is the Inflation Reduction Act? The Inflation Reduction Act, or IRA, was signed into law in 2022. The aim was to address economic issues while reducing inflation and lowering healthcare costs, especially for Medicare beneficiaries. The goal was to improve Medicare and Medicare solvency by lowering drug costs, expanding benefits, and to stabilize Medicare costs. Okay, so there have been some layers of change and a timeline of cost shifting as this act has unfolded. In 2023, Part D vaccine coverage expanded. So this meant that there was no deductible or cost sharing for adult vaccines. The insulin savings program was also implemented. This made out-of-pocket costs for insulin capped at $35 per month supply for a covered insulin product. They also expanded LIS, or it's also called Extra Help Low Income Subsidy, to include people with Medicare who have low incomes up to 150% of the federal poverty level, and resources at or below the limits for partial low income subsidy benefits to be now eligible for full benefits under Part D low income subsidy program. The law eliminated partial LIS benefit that was in place in the past for people with low income levels between 135% and 150% of poverty. In 2024, once an enrollee hit the catastrophic phase, the cost share for the remainder of the year was $0 cost. Previous to this, the enrollee still had to pay 5% of costs in the catastrophic phase. So in 2025 comes the most impactful changes yet to prescription drug plans. So now we'll hear from Christina.
Christina, who was muted. Thanks, Melissa. I'm Christina Morano, licensed insurance agent with Translating Insurance. Given all these changes, what does it mean to you? Specific details of each plan isn't released until October 1st, but we have a general idea of changes based on what we know about the impacts of the Inflation Reduction Act cost-sharing changes. Medicare was built on a foundation of cost sharing. In the past, the cost of medication was shared by Medicare, the Medicare recipient, that's you, the insurance company, and the drug manufacturers. With the Inflation Reduction Act, Medicare will shift some of the Medicare recipient costs and some of Medicare's costs to the insurance companies and the drug manufacturers. In the past, Medicare has paid 80% of the costs in the catastrophic phase of coverage. But now in 2025, they will only pay 20% of that burden. The drug manufacturers will also pay 20%. That means that insurance companies previously paid 20% of the prescription drug costs in the catastrophic phase. Now in 2025, they will be liable for 60% of the costs of the Medicare beneficiaries' drugs in the catastrophic phase. In essence, Medicare is decreasing how much they are paying and how much Medicare beneficiaries are paying, but significantly increasing the liability of the insurance companies. So what are the expected impacts of these changes? You will pay for your prescriptions until you meet the deductible for your particular plan. Once you have met that deductible, you are responsible for 25% of the drug costs until you paid a total of $2,000. After that, you are done. The rest of the costs for the year are covered by the plan, Medicare, and drug manufacturers. The coverage gap, also known as the donut hole, is being eliminated. Even with an annual out-of-pocket maximum of $2,000, some people can get hit with large expenses at the beginning of the year. To help that, Medicare is introducing the M3P payment plan. This creates a payment plan program for that $2,000, which allows you to make consistent monthly payments throughout the year and will have a smoothing effect on the costs incurred at the pharmacy. There's more information coming out from each of the insurance companies on how and when to sign up for this. So stay tuned to your annual notice of changes and other communication from your plan and from us. What's next? Be informed and be ready. You are already doing great by watching this webinar and reading our emails. We're here to help. While the insurance companies are doing their best to absorb these new costs and new responsibilities, we do expect to see some changes to the standalone Part D prescription drug plans and Medicare Advantage plans. These changes could include increased premiums, added or increased prescription drug deductibles, reduced formularies, and potential reduction of other benefits. Some companies are simply eliminating some of the prescription drug plans altogether. Your insurance company sends out an annual notice of changes in September or October, which will detail all these changes to your plan. These may come by mail or by email if you've opted in to receive communications by email. Look it over when it arrives so you're aware of the changes. Also, we are scheduling ANOC, stands for Annual Notice of Changes, webinars for most of the carriers, and we'll review the changes and answer general questions for you at that time too. If you haven't already, request and complete your prescription and provider update form from us by email. We will collect the information and start reviewing plans as soon as they become available on October 1st. Then we will reach out if we recommend changes, or we'll let you know that you're good to go for 2025. Rest assured, we are staying on top of all the changes and will help you navigate anything that needs to change for you. Now I'll hand it back to Jackie.
Thanks, Christina and Melissa, for going over that valuable information. In a few minutes, like I said, we will open it up for a Q&A, but I did want to quickly touch on the Medicare drug price negotiations. So one of the Inflation Reduction Act's key drug-related policies is a requirement for the Secretary of Health and Human Services to negotiate prices with drug manufacturers for certain drugs starting in 2026. So back in September of 2023, CMS, which is the Centers for Medicare and Medicaid, published this list of the 10 Part D drugs that they would negotiate first. Then on August 15th of this year, so just a couple weeks ago, CMS announced the negotiated prices of these 10 drugs. As you can see, some of them are significantly decreasing. So a lot of these are ones that you would have seen in the brand name tier, and generally always subject to the deductible and higher copays on those Part D plans. These new negotiated prices are going to take effect January 1st of 2026. And CMS estimates that Medicare beneficiaries will save $1.5 billion when these negotiated prices take effect in 2026. The number of drugs negotiated will increase to 15 Part D drugs for 2027. And then by 2028, they're going to begin negotiating not only Part D drugs, but Part B drugs as well, the kinds that you get done at the doctor's office or an infusion center. So, and another 20 drugs will be negotiated for 2029 and later years. So as you can see, they're coming at this from all fronts to help reduce out-of-pocket costs for Medicare beneficiaries. So I just want to do a real quick recap of the changes. One, there's going to be a cap on your out-of-pocket Part D prescription drug cost sharing for 2025 of only $2,000. For some of you, you might not even get close to hitting that. But for others, this is a huge reprieve. You could see premium prices go up, though, on those Medicare Part D standalone drug plans, and you might see some cost benefit changes on your Part C Medicare Advantage plans so that the insurance companies can shift some of these drug costs into other parts of the program. Another change, there's no more donut hole, no more coverage gap. So once you get through the deductible phase, like Christina said, and the initial coverage phase, you're done. Keep in mind, most Medicare Advantage plans with prescription drug coverage will be adding a drug deductible back to their plans, primarily for Tier 3 through Tier 5 prescriptions. So when you get that annual notice of change that Christina talked about, take a look at the drug deductible on the plan so you don't get blindsided. The M3P, or Medicare Prescription Payment Plan, is available for the first time ever, where you're going to get to set up a payment plan for your drug copays if your drug copays exceed a certain threshold. So that's something you can opt into at the pharmacy. The pharmacy will notify the plan, and the plan will reach out to you to get that set up. Basically, they'll just divide that copay up into the remaining number of months that's left in the year. So if you go in January, they're probably going to divide it up over 12. But if you go in March, they're going to divide it over 9 or 10. So it just depends on when you go. One thing to be sure, again, we mentioned this, watch out for that annual notice of change in the mail, or if you've opted into paperless delivery, check in your email for that annual notice of change that will come at the end of September or early October. And as Christina mentioned, we are hosting webinars the first 2 weeks in October. Every carrier that we, the major carriers that we represent will have at least 2 that you can sign up for, so morning or afternoon. We're going to do it for Providence, United Healthcare, Regents, Devoted, Pacific Source, WellCare, and Aetna. If you'd like an invitation to your insurance carrier's webinar, let us know and we'll get that invitation out to you. So just a reminder, our help is no cost to you, but we do have a process in order to make sure that we don't miss steps. So first, we send out a digital prescription drug update form so we can gather a list of your current prescriptions. If you need a paper form, we can mail it to you with a self-addressed envelope. You just stick it back in the envelope and send it back to us. So don't let the digital thing hold you back from getting us that updated drug list. Once we review your drug list and run it against 2025 plans in the beginning of October, we will reach out and let you know if you need to make an appointment with us to make some changes, or if you're good to stay where you're at. But we can only do this review if you've provided us with an updated drug list. Even people who just signed up for Medicare this year will still need to have a review done for 2025 because these changes are so drastic. So if you haven't provided an updated drug list, or if you haven't received a link from us to complete this updated prescription drug form, just reach out and we will email that to you or mail it to you as soon as possible. Our goal is to make this a stress-free process for you. Just let us know how we can help. And again, if you guys have friends or family who don't have a broker that they're working with, we would be happy to help. So if you want to refer them over to one of us three ladies at Translating Insurance for a review, we will treat them just like we treat you, which I hope you guys feel treated well. Anyway, we do appreciate your referrals, and we also appreciate you guys for being our clients, and we just want to help as many people as possible to get through this transition over to 2025.